Sonali, you're in mute. You are in mute, Sonali.
Good evening all. I welcome all the panelists and NEET PG aspirants for today's webinar on Know Your MD, MS and DNB branches. Welcome everybody. It's my immense pleasure to be introducing you to Dr. Govind S. Mittal, who is the speaker and the moderator for today's webinar. Dr. Govind has completed his MBBS from Bangalore Medical College and later his MD in dermatology from India's most reputed college, CMC Vellore. He was awarded the Best Outgoing Student of the batch and the Gold Medalist in Physiology during his MBBS at BMC. And in the panelists today, we have Dr. H.S. Satish, Dr. Sandeep Reddy, Dr. Chanakya Khoisla, and Mr. Vikram Kumar. I would now like Dr. Govind to introduce to the panelists and take ahead the session. Sir?
Thank you, Sonali. Thank you for the kind introduction. A very warm welcome to all my panelists here. I welcome Dr. H.S. Satish, sir, who's joining us from Bangalore. Welcome, sir.
Thank
you. Welcome our CEO, Mr. Vikram Kumar, sir. Welcome to the session. And welcome, a very warm welcome to my dear friends and colleagues whom I have actually worked with. Dr. Sandeep Reddy, sir, who is an internal medicine specialist, and Dr. Chanakya. Dr. Sandeep Reddy, sir, is joining us all the way from UK, and Dr. Chanakya is joining us all the way from Minnesota, Mayo in US. So let's quickly, I'll just start my presentation, and we'll have a little more detailed introduction of our speakers or panelists, to be precise. So first of all, welcome to all the dear doctors, NEET PG aspirants. Today's webinar is going to be how we can help you select your branch. We, the team of medical mentors, can be always contacted on the number given to you below. And first of all, the fact that you have reached here, the fact that you have finished your NEET PG exam, got a rank, got a qualifying score is indeed commendable, is indeed extremely good, and I would want to congratulate each and every one of you for the same. Sonali has introduced me. Yes, I'm a practicing dermatologist from Bangalore, and I was trained by one of the esteemed panelists present here, Dr. H.S. Satish sir. He has been my teacher when I was in Bangalore Medical College. He also served as the Dean and Director of our institute, BMC&RI, and has a professional experience of 32 years and teaching experience of 26 years. So we are bringing you a lot of, experience-based discussion in this webinar. He also served as the medical superintendent of Victoria Hospital, Bangalore, and has very recently been an advisory member to the government of Karnataka in control of the mucormycosis infections during the COVID pandemic. He did his MBBS training from Bangalore Medical College and Research Institute in 1982 and went on to do MSc ENT from JJM-MC Davangere, and has got several academic awards, including the WHO Visiting Scholar Award, the AOI Travel Fellowships, and if I go on, I can have a seminar on the CV itself. So wish you a warm welcome, sir.
Thank
you. Yes. So next, I'd like to welcome my dear friend, Dr. Chanakya. I have known him as Chanky. That's how I used to address him during my, MBBS days. We have been batchmates, friends, right from the times of the dissection table. He has done his DNB internal medicine from St.Johns Medical College, Bangalore, and he will be giving us a lot of inputs about DNB today. So stay tuned for that. He further went on to do DM rheumatology at Hyderabad Nizam's Institute of Medical Sciences, and has worked as an assistant professor in clinical immunology and rheumatology before he moved to his current post, where he's taking a research sabbatical at Mayo Clinic, Rochester, in Minnesota, USA. So welcome, Chanakya. Thank you for taking time for joining us. Of course, he has received several awards that you can see on the screen right now. And thank you so much for joining us all the way from USA, Chanakya.
Thanks, Govind. Glad to be a part of it.
And very glad to introduce Dr. Sandeep Reddy, sir. I have closely worked with Sandeep, sir, in the hospital. You know, we share a huge base of common patients, and he handles the, you know, the general medicine issues for all my dermatology patients and vice versa. So it is nice to have him here on this common platform. Now, he also happens to be a BMCite. He did his MD Internal Medicine from Bangalore Medical College and Research Institute, after which he has done certifications after certifications after certifications and courses in infectious diseases, starting from Hinduja Hospital in Mumbai. And then he also did a diploma in tropical medicine from the London School of Tropical Medicine and Hygiene in UK, and then did a certification in implementation research and research training under the WHO, and currently is pursuing MSc in tropical medicine and international health. If I look at his CV, there are so many interesting topics that I can see, you know, a concept called One Health, and you know, which I would encourage all my PG aspirants to type and find out what this concept of One Health is. Quite interesting. And he's ever interested in infectious diseases. So a very warm welcome to you, Sandeep sir, for joining us all the way from UK. I think you're muted, sir. We can't hear you.
Yeah, it should be clear now. Yeah. Thank you, Dr. Govind, for that. No one's sugar-coated my resume so well.
There's no sugarcoating, sir. It's all so sweet. Don't worry.
Now I know why you're the most sought-out dermatologist in Bangalore. I'm sure your patients love the way you present your diagnosis.
Okay. So without much ado, let's go on to the seminar proper. I hope to keep up my time and for this webinar. My dear listeners, my dear doctors who are listening to this whole webinar, there's one disclaimer that I would want to give you. Now, in this webinar, there is no right or wrong answer. These are basically opinions and views that are those of me, the speaker and the moderator, and the panelists that we have invited today in this evening, based on their experiences and understanding of medical specialties. By any means, we do not wish to say that any specialty or choice is superior to the other. And if any inference such felt is not the intention of this webinar, I want to make that really, really clear. We're not entering controversies after this webinar, but this is just to provide some clarity about various branches in the field of medicine and the specialty that you could choose. Therefore, after this webinar, I would encourage students to take their own decisions in light of the viewpoints we have expressed, as suited to one's own needs and interests. So this webinar is to help you answer the question, which is the best branch or specialty suited for me, so that we can eliminate the thoughts of doubt and fantasy. Sometimes you just fantasize a particular branch, but we want you to just come in touch with reality, facts, truths about specializations, and let's help you to take those decisions based on experiences of those who have been there and done that. Okay. So before I go to the panel discussion proper, I'll be discussing certain branches briefly, and we will be slowly bringing in the panelists to answer our questions. So this slide has been time and again put in our webinars, where we have discussed what are the various types of postgraduate courses you have. So we have clinical branches and non-clinical branches. So clinical branches seem to be the most sought after branches, and we will be concentrating our today's talk on clinical branches per se. And this could be surgical or medical branches or non-surgical branches. So coming to surgical branches proper, so surgical branches could deal with significant patient interaction where you have general surgery, orthopedics, obs and gynae, ophthalmology and ENT, and not a real surgical branch, but a branch associated with surgery with lesser patient interaction, or rather direct patient talking and history taking, stuff like that, is anesthesiology. Okay. And coming to the medical branches with less patient or no patient interaction would be radiology or radiodiagnosis, and branches with significant patient interaction, and or rather to say that medical branches are to do with patient talking, patient diagnosis, patient counseling, are of course general medicine, pediatrics, dermatology, pulmonary medicine, and psychiatry. Okay, so how should you approach choosing a branch? Now, very commonly it is said that choosing a branch is like getting married. Yes, this is the second most important decision apart from choosing a life partner, is choosing your specialty, because it is something that you're going to be associated for the rest of your life. So it is very important that you take this decision in a very, very sensible manner, and try to take this decision as to where you want to see yourself 10 years down the line. It's not about what you're going to do for the next 2 or 3 years. It is something that you're pursuing for the rest of your life. So I want all of you to imagine what you will be seeing yourself, where do you see yourself, and what do you think you'll be doing 10 years down the lane? Do you see yourself, actually in the OT operating day and night? Do you see yourself, seeing images, making diagnosis based on CT scans, MRIs, and stuff like that? So you need to put yourself in the shoes of a specialist and check what specialty you can imagine yourself doing, and do not choose a specialty based on short-term stress or gains that any specialty, or rather PG life, has to offer. There is no PG course that is going to be fantastic or great in the first 1 or 2 years. Every PG has had a stressful life in his first year PG, or maybe it's second year PG, and third year brings its own stresses. So do not base your branch based on, okay, this college, this particular course is going to be really, really easy. If a very important statement I'm making here, if a branch is easy in a particular college in the very first year, I'm sure you do not want to pursue that branch in that particular college, because you ought to be busy for the next few years, because these are the years that you'll be gathering a lot of information, you'll be doing a lot of studying, seeing a lot of patients. That is going to be the fundamental basis for you to build upon your professional career. So there are a lot of factors that are often looked into apart from one's own interest. Okay, so this is a little bit of discussion I would like to bring upon here from my panelists about so as I already talked about PG life. Yes, so there's a lot of people who base their decisions about future life, how their future life is going to be, what is their family time going to be, will they have night duties? So Satish sir, could we have your opinion about should or should not, students, and how much importance should they give to these particular points about, how the night duties are going to be, how the future life is going to be? What are your points, as because you're most senior amongst us, you've seen, so how much of your thoughts way back as a PG student matter to you now, and how does it all look in the large time frame?
Yeah, thank you very much, Dr. Govind. Namaste to everyone. And again, I congratulate all the students who have rushed through NEET. And now they have to do a lot of thinking as to join to which specialty. See, I always see this as 3 categories. One, some people are already into the surgical field. Some are into the medical field. And the third category, they are sitting in between. They are neither decided to surgical nor medical specialties. See, regarding the duties and other stressful situations you are discussing, see, life itself is a stress. I don't know whether you remember that song, Chocolate Khane mein stress hai, something like that. There is one song, I think. See, yes, that, it all depends on how you take it. See, you should enjoy it, eating your chocolate. Just like that, your PG course also. So what I feel is, see, some of you have already decided to go into the surgical fields, no problem. You join any surgical field. And as Dr. Govind pointed out, this is 24/7. So you are called at any moment and you should be ready. And yes, first 2 years are very stressful because you are trying to make a good foundation and you are the junior most in the department. And every small thing will fall on you and you are expected to do everything. So it takes some time. By the time you come into third year, again, the stress level will shoot up because your exams are fast approaching. So it is always there. Stress is part of life. You have to take it and try to understand and manage it. So each person, I mean, it is individual. They will manage and definitely life will teach you. But one point I want to make it here is, see, you always have a plan B. I agree. Some of you really want to become surgeons. Unfortunately, sometimes it may not be possible. So don't worry. See, what I feel, even paraclinical, preclinical, if you excel in them, definitely you can go a very long way. So don't lose your heart. Keep a plan B always with you. It is going to help you in the long run. Okay. Then, few things you have to consider. As Dr. Govind, in fact, pointed out, number one, the duty hours. Number two, how much you are going to earn and what you want to do down the lane for 10 years. And whichever specialty you go, it's a constant learning. See, for example, when I was an undergraduate, things were different. Then post-graduation, it improved a little. And now the pace is so fast, you can't keep up. That's why it is branching out. Everywhere you have super specialties. And just as a joke, people say, see, I am basically an ENT surgeon. You will have down the lane about 20-25 years, people operating only right ear or people operating only the left ear, something like that. Of course, now itself, it has divided. See, ENT, it has ear, nose, and throat. Now we have rhinologists. See, they do endoscopic surgery, go up to the base of the skull. See, nowadays, when we were undergraduates, only two surgeries we used to hear: tonsillectomy, septal surgery.
DNS.
Now things are so much. As I said, down the lane, you may become a otologist only for the right ear. So please keep that in mind. And it's a constant, this thing you have to go on learning. I think I have covered most of it, I think.
Sure, sir. I will be coming back to you with a little bit detail for the surgical branches.
Sure.
So, Dr. Sandeep Reddy, sir, I would want to bring in you here for the point of, so as I can see in your CV, you have been constantly been a doctor in training for the last several years, and I guess most of us are. And many young doctors pose this question of which branch can I really settle early? Also, to bring in the point that your wife is a gynecologist, and this question can get a little personal. You had a baby recently, so where should doctors think about this early settlement when when they are deciding upon a branch, or if someone has loans to clear, or someone is getting very older in life and want to settle early? So some views about that you would like to give based on your experience, Sandeep sir.
Yeah. Hi. First of all, greetings to everyone present in this webinar. I love to convey love from the Queen of the Great Britain to all the people here. So, coming to the question of early settlement, we never settled per se such in any specialty. I mean, Dr. Govind is one of the sought out dermatologists in Bangalore. Do you ask him, are you settled, Dr. Govind? He would say, no, I just bought a laser machine. I can't be settled right now. So that's how it is. But if you're thinking of early settlement in your life, whether it could be because of various personal reasons in the family, you've got your parents to take care because they are getting older. They are coming to their retirement ages. Some parents might even be retired and are just living on pensions and looking upon their children for help, for financial help. So you want to make sure that you're there help as a financial aid for your parents. Clinical subjects would be very difficult to settle down. As our esteemed Professor Dr. Satish was mentioning about saying it's branching out. Everyone wants to be a specialist in certain specific regions, specific organs. So clinical subjects, whether it's medical or surgical, it will be very difficult. But then please do not forget preclinical and paraclinical. Just because it does not have that aura as compared to your clinical subject, but people are so important. Right now, medicine is so dependent on each other. I mean, I'm sure Dr. Chanakya will concur with me that right now surgeries are happening in United States with an anatomist inside the OT. He has to do the markings, and only then the surgeon will start the incision. Without an anatomist in the OT, the surgeon can't, because any scar, any keloid will the patient can sue the doctors and the surgeons for doing the wrong incision. So every other preclinical, paraclinical specialty is good. We are becoming dependent on them, whether legally or different reasons. Pharmacology is booming up. Physiology are doing a great job. Biochemistries are helping us with all the new medications and all the new formulas. So if early settlement, you have a better chance with the preclinicals and the paraclinicals, because you finished your 3 years of MD pharmacology, you're just snatched by the pharma industry out there. They're just waiting for good pharma MDs for their clinical trials, for their companies. So you're settled in a blink. So preclinicals and paraclinicals, you can get settled quite soon, but clinical, it's a challenge. It's the compromises that you'll have to make if you would like to settle fast. And just from an experience from one of my colleagues who finished his MS General Surgery from Bangalore, just as he finished, he had a son, and then he got a super specialty in gastro surgery, and he had to go to Amrita Institute in Kerala. Now he finished that and he's come back, and he just celebrated his 3rd year birthday of his son. And I was having a chat with him, and he said the 3 years he has absolutely no connection with his son. So now he wants to spend time with his son, make up for the lost time. But then is he going to do that? Because he's just going to start his new life as a gastro liver transplant surgeon in Bangalore, and that's going to take time. He needs 5 to 10 years down the line to be the recognized liver transplant surgeon. So it becomes really difficult. He's compromised on his family life. He's compromised on his first 3 years of his son's life. But then he's never settled as such. So preclinical, paraclinical, my opinion, you can get settled fast. Clinical, it's a huge toss of a coin.
Fantastic views. And we will be coming back again. And so let us proceed a little more in detail on what else one should look apart from, interest. So earnings, we'll be talking about that. Saturation of metros. Now, this is indeed a major issue. And I guess that is happening with almost every branch. So, somewhere down the line, we as doctors have to start looking into the fact that, we have to even start moving to peripheries. Or the other fact that you can look at it is the cities are growing and ever growing. What Bangalore was 10 years back is totally different from what Bangalore is today. So when I just started my my dermatology career in Bangalore, I was like, okay, this is not going to happen here. I need to move to a tier 2 city. But it's just that you need to hang on and, build in your niche and do your hard work, do your good work. And then it doesn't matter whether you're in a city or a taluk or a village. I guess everyone can do well. So I think this was a part of the message that Dr. Sandeep also was giving. Then we also have to think about the expenditure on the setup, depending on the branch that we want to take. So finally, all we want to be is a happy doctor or a happy person in life. So very importantly, I would want to tell all my listeners today is that concentrate on doing a branch that really makes you happy rather than any other variable. So it can be a branch that gives you loads of money, but if you're not happy with the branch, you'll still be sad sitting on those loads of cash, so piles of cash. So I would strongly say that choose a branch that really makes you a happy person at the end of the day, that offers you a lot of job satisfaction. Also, another way to choose your branch is to rule out options. And a lot of us have a lot of we are interested in this, we are interested in that. For example, I remember when I was finishing my internship, I had 3 branches I loved surgery, but I was not sure that I came from because I came from a non-medical background, how early I will be able to settle down. I was a person who cannot probably work under a boss as a junior for a long time, and that doesn't happen very soon, or rather that always happens with surgeons. So I was not sure that I want to take up surgery, and I was interested in endocrinology, so I had to go to the general medicine branch, and I was interested in dermatology. So there's a lot of branches that you could be interested into. So if you're interested in, and if you're confused about what branch to take, an important way of approaching your branch would be to rule out certain options, whether you want to consider this, that, and that would help you decide as to what you want to do. So what are the branches, what are the points that you should really, really not take into consideration when you're choosing a branch? So if a branch is saying that it's giving you a great amount of money, or return on investment. Now, this is very, very important. I had a student who asked me very recently. He said, I can afford a seat in a medical college through management quota, and I can spend about 1 crore a year. And so if I take up dermatology, will it give me the return on investment? Now, I would want to bring in Dr. Chanakya. What according to you is return on investment for taking a medical seat? Dr. Chanakya, are you here?
Yeah. Can you hear me, Govind?
Yes.
Yeah. Thanks everyone for having me here. So return of investment. So this is an interesting point. So yes, I agree, totally agree that this should not be, definitely not be your choice reason for selecting a branch. Because there is no such thing as return of investment in any of the medical branches. It most often happens that, see, you may be having a lot of money and all that stuff, but it most often happens that your whole focus after you finish your post-graduation will be to how can I get back this investment, and that should not be the way we should all work. I mean, the reason that you're selecting a particular branch is because you love that branch, you want to progress in that branch, you want to help patients who are suffering from the diseases, pertaining diseases, and you will earn as much as money while focusing on this when you're not focusing on the return of investment. So I totally agree with this should not be the reason for you to enter any branch.
Thank you, Dr. Chanakya. So I actually told that medical student, if you're thinking of return of investment, the best thing you should do is take those 3 crores and put it in mutual funds. The way the Sensex is rising, the way the markets are doing, I'm sure that will give you the better return on investment. So the only return on investment that you can expect at the end of 3 years is that you are a specialist, or you are a doctor of that particular branch. That alone is the best return on investment that you can get. Okay, so money comes much later for a doctor. Earning takes time, and we will discuss that a little more. So just because you got a very good rank, don't take up radiology. No, there's a lot of people who are very confused about that. Sandeep sir was telling me very recently that how many of people he knows have actually ended up not taking up, rather giving up their seat, and then again taking up another branch, because later they realized how radiology was not their cup of tea. Another myth is, I like children, so I want to do pediatrics. Liking children is not equal to doing pediatrics. The same children you like can drive you nuts when you're in the clinic, when you're in the wards. So I would definitely not want to second such thoughts. So think about it more practically. yes, I want to be a aesthetic dermatologist, cosmetologist. It sounds so cool, but I can't see tinea cruris patients, So it is a branch, is a mix of everything that it has to offer. So you have to, accept each and every disease that your branch throws at you, so that you can do justice to the branch you're taking up, or the profession you're taking up. So with this, I will discuss a few slides on the individual branches. And I actually ran this exercise with my batchmates of Bangalore Medical College. I sent them questionnaires just about 24 hours back, asking their views about their branches. So I received an overwhelming response, and I thought, rather than putting in my thoughts, and since we are not able to bring panelists of all specialists on this webinar, let me put in the real words and thoughts of specialists who have passed out of Bangalore Medical College just about 10 years back, and what they're doing in their lives now, and what do they feel about their branches. So let us see. So radiology, the pros of radiology. It's a perfect end branch, provides a great work-life balance. However, today, many subspecializations like interventional radiology, neuroradiology, musculoskeletal radiology, medicine, etc. are coming up. Now, earning is good and comes very young, when you're, quite young itself, if you take up radiology, and you can be the master who decides how busy you want to be. Setting up your own center is relatively easy. I'm not sure if I totally agree with that, but it is extremely expensive. Buying an MRI machine, buying a CT machine is not everyone's cup of tea. So that is something that you need to consider if you're, taking up radiology and planning to have your own center. And but they say it is quite rewarding if you have your own center. Getting into medical colleges and government sector is relatively easier in radiology compared to other branches. This is the scenario right now. Yes, there are more avenues, and there is huge scope with tremendous opportunities at taluk places. There are no night duties and relatively stress-free life. And it is a fantastic branch if you enjoy diagnostic challenges. So coming to the cons of radiology, so a lot of the toppers who just go blindly take up radiology, I want you to understand what are the cons of this field, and just check if it is your cup of tea. Okay, so there is lots to study. It's literally never ending. You really need to know, you have a lot of knowledge about many subjects, like you need to know anatomy very well, physiology very well, pathology very well, and most of all physics. Physics was something that you last studied more than 5 years back, so you need to know that. And it is a branch which has great advances technologically. So we do not know if artificial intelligence will be changing certain shape. This can be considered as a pros and cons. So a lot of the pros and cons that I've talked about, it depends on from which angle you're looking at. A pro for me may be a con for you, so that's one thing. Then ceiling to the pay. So a radiologist starts earning well to start off with, but after a certain point, it hits a plateau or it hits a ceiling, and you may not be able to increase your value as you increase in age. Not a surgeon, whereas starts rising a little later in life, but then his value increases based on his experience. So that's a very important point that you need to understand. And it has very minimal patient contact, the field of radiology. And for those who like to be among patients, like to talk, like to discuss a problem, I don't think that's the best branch. There is less recognition for good or smart works, just like anesthetist. You might have made a clinching diagnosis on an MRI scan, which the clinician would not even have thought of, but nobody comes and tells you, oh, thank you very much for making this diagnosis for me. So it's a field that you need to derive job satisfaction on your own. Okay, and some patients will not even know that you're a doctor. A radiologist told me a patient thinks that he's a technician, really doesn't have anything to do with an MBBS degree or an MD degree. Then creating a referral base. If you have a center of your own, creating a referral base is quite tough, and slowly things are changing with teleradiology coming in. So this was about radiology. Coming to anesthesiology. So my good friend Chanakya has referred to it as the backbone of all surgical specialties, and I cannot agree, less with this. It's quite rightly put. So it's a relatively easy clinical branch to get, but it feels like a dead-end branch. And 3 years of training is usually enough, and people can optionally opt for DM and fellowships. And the responsibility that an anesthetist shares for a patient is here a little indirect. The direct responsibility is that of a surgeon, what the patient sees. Now, it's a versatile branch in terms that you can easily move to critical care or even pain medicine, and has great avenues with respect to critical care medicine. And there's a high demand for ICU specialists and emergency physicians, especially what we have seen in the COVID era as well. Disadvantage, lifelong night duties, and OT really starts early in the morning. So if you're not a morning person, then anesthesiology may not be a branch for you. If you cannot wake up really early in the morning every day, it may not be considered as a cool branch by many. Again, ceiling income happens. Your income hits a ceiling, and many people feel that it is stressful and they're not paid for the amount of work they do, and their work often may get unnoticed by both the patient and the surgeon. And here the profession is quite dependent on the relationship with the surgeon. So you're actually dependent on another specialist based on for your professional excellence in many such cases. So that could be an hindrance for some. And you don't have your own identity, patient base, or your own self OPD unless you're doing a pain specialty or something like that. So that's something to think about. So these two branches are which you have to derive a lot of self-satisfaction with respect to the fields you're doing. But a good point here I came to know was these are two branches where junior consultants or a younger consultant is usually preferred over the older ones. The reason being that juniors do a great job, they're more updated, they do everything that the seniors can do, and they will do it at a lower pay. So this was one of the views that some of my friends presented. And let's talk about surgery. So let me invite Satish sir again. So what are your, I will share the words of my batchmates, sir, but since you're here, I would want your opinions on, what are the relative pros and cons of taking up a surgical field?
Yeah, first and foremost, it is very glamorous. See, you are recognized as a surgeon and you have a knife in your hand, and you do get a good amount of money. And yes, you can, of course, tailor make your surgical options. That is, you can either operate in the morning or evening, whatever it is. And definitely, the earnings will be very high. And if you are a good surgeon, you can make a lot of money and in a very short time also. But the disadvantages are, again, it will be 24/7. Once you operate a patient, till he is discharged, he will be a headache. Any complication, you have to look into that. You should be able to manage, and you should be highly successful, number one, and number two, highly updated. See, things are moving so fast. Unless you have updated yourself, people, they have become Google doctors now. So they will read mostly about the complications and come back to you. So be careful when you are a surgeon. Know everything, then operate. Or you have to have a good mentor so that you learn everything, every trick of the surgery you learn, and then venture yourself and do great work. The other disadvantage is you tend to get sued. So you should be very careful, and you should have a logical explanation for everything. It should be legal and be updated. That is very important.
Okay. Since you mentioned, about you should know everything before you operate, there is something that is also said very importantly about surgeon. You should know whom not to operate.
Yes, yes,
so
exactly.
That is also, so I think it requires a lot of restraint and a lot of experience to make those calls. Thank you so much, sir, for your opinions. And sir is also an ENT specialist, and so is my wife. So I got these points from my wife about advantages and disadvantages of being an ENT. So somehow, for some reason, ENT was a branch that I personally never wanted to take. No offense, sir, but but third year of MBBS, I knew that I cannot hold that speculum and look into people's nose, or take that speculum and look into people's ears. So I was like, I had eliminated ENT a little too early in my whole process. So as you say, Murphy's Law, I ended up with a life partner who's an ENT specialist. So anyways, so coming to advantages of ENT. So it is a surgical branch, but surgeries are not too long as that you may see in other kind of surgeries. It has a good mix of surgery and medicine. Emergencies may not be too many. Specialization is not a must. But as Dr. Satish says, now you have rhinologists, laryngologists, and cochlear implant surgeons, all of it going into subspecializations, and a lot of options are also there. Disadvantage, of course, like any surgical branch, has a long learning curve and deals with a lot of micro work. If you really like doing delicate surgeries, delicate work, then I think ENT could be an option apart from ophthalmology, of course. So, and a lot of overlap occurs with general surgeons and oromaxillofacial surgeons, who says, okay, this was an ENT surgeon who should have done it, or probably a general surgeon should have done it. So that is another branch to branch, kind of, little fights that people have. But and the other important point, what young doctors should know, is that patients always prefer a more experienced and an older surgeon. Like today, if I want to go get a surgery done for myself, obviously I will think of who has done how many surgeries and probably get operated by under their hands. So your settling time is going to be more. So just to extend this to other surgical branches, I got these brilliant views from one of my plastic surgeon friends, but these views are not limited to plastic surgery. It's more about general surgery. Definitely you can earn more, especially if you specialize in a niche surgery, but earnings will come much later. You are very important for a corporate hospital. A surgeon has more job security, especially if he's working in a corporate hospital. And that is one specialty that cannot be replaced by artificial intelligence. You need, even if you have robotic surgeries, you have keyhole surgeries, whatever the advancements, you need a surgeon to do it. And a lot of amount of self-satisfaction, you see, it's quite gratifying a field because you see the changes happening, and there's a lot of avenue for creativity, especially in plastic surgery, and especially if you enjoy doing work with your hands. So disadvantages: learning curve, grueling training, takes time to establish yourself, and if you're establishing your own or your own center, then you need a lot of money, and litigation and super specialization. So as already discussed, let's quickly discuss orthopedics. So again, the advantage is gratifying results, visible results, a lot of job satisfaction. Potentially you will earn more. There is no age bracket that you're treating. You treat patients of almost all ages, and now slowly there are options of super specializations such as endoscopy surgery, pediatrics, orthopedic surgery that are coming up, and post-op care is not too bad and demanding as compared to other surgical branches. Disadvantages, of course, emergencies, family life is compromised, and women have this concern about requiring physical force to do an orthopedic surgery, and they don't want to take up orthopedic. But now there are a lot of aids available, so need for real physical force in doing an orthopedic surgery is not much of a rule. So, and you need a team more often than not to do a surgery, and overlap with the neurosurgery and plastic surgery that has started over the last few years. And there is this 80-20 rule, which applies to most branches, but I'd like to bring it out here, and the saturation of metros. So 80-20 rule that my friend told me is that 80% of your surgeries or 80% of your patients are seen or operated by 20% of the best surgeons. Whereas, so that is what is seen in most of the branches, and 80-20 rule is quite common to almost every field of your life. I think you must read this book on 80-20 rule. That you can Google about this. And as in any surgical branch, you need to be really good at your field to excel, as Satish sir said. So let's discuss Ophthalmology very quickly. Advantages, very satisfying to help patients see better, especially since the majority of our patients are elderly, and giving them the gift of sight is very, very, gratifying, and because they don't have to depend on anyone else further. Then great money in private practice, especially if it is your own and not many emergencies. Microsurgical techniques, take a lot of time to master. There could be more medical legal complications, very expensive equipment, and although earlier it was thought and considered to be an end branch, it is no longer an end branch, and you need a fellowship or an MCH mandatory nowadays. And one of the important viewpoints proposed was the training is a little suboptimal with reference to ophthalmology in DNB in many centers. Okay, so coming to psychiatry, I will slowly bring in my other panelists after this slide. So psychiatry, yes, brain and mind are among the final frontiers in science with unlimited scope for new research and insights. What a wonderful statement. Yes, psychiatry is a branch that has not been explored enough in our country and requires, there is a lot of scope of research, and you get to work on the human side of illness, the psychosocial aspects of illness, and it is quite intellectually and emotionally rewarding to see patients doing well as you treat them in psychiatry. And psychiatry is inherently multidisciplinary, so you have to corroborate with other people, do a lot of team work, and there is a lot of unmet need in our country, a lot of treatment gap, and a lot of cases rising, especially after the pandemic. So psychiatrists are needed, and it's a branch which is relatively easier to get compared to other clinical branches. So if you have the liking for it, then you should definitely go for it. It also gives you a good work-life balance. Now, cons, it's not just patients, even psychiatrists face a lot of stigma and discrimination from fellow physicians. Now, this is quite interesting, but I think anyone discriminating about you or your branch should really not matter as long as you like the branch. And because it requires a lot of skill set about talking, you being open, so it's not everyone's cup of tea, and it can be really emotionally draining to see a lot of suffering in people around you. Also, training and good teachers are probably not plenty, is what my friend and colleague says, and it is very tough for someone to cover the length and depth of psychiatry. And of course, for the amount of effort you put, it may not be as financially rewarding as other branches. Obs and Gynae, easy to get, highly satisfying to see. I think Obs and Gynae was one of my best postings. It's a most wonderful feeling to have a newborn baby in your hand. In fact, me and Chanakya did postings in labor room together. So it is definitely a wonderful feeling to have, a newborn baby in your hand. And you can definitely earn well, although it depends upon the amount of practice, competition, and although it is an end branch, there is a scope for specialization in fertility, laparoscopy, maternal fetal medicine, and so on and so forth. Cons, of course, quite unpredictable. Your family life is really, really compromised. You need to attend to the patient irrespective of time of the day. Work-life balance is really screwed, and metro saturation, like for a lot of practice, highly prone for malicious practice litigations and can definitely be stressful. So pulmonary medicine, end branch, high in demand. There are a lot of subspecialties in pulmonary medicine, and it is a branch that is only going to increase the number of patients twice, because of pollutions, infections is only going to increase. So more patient load, chronic diseases, long-term follow-ups, and it's easy to run a clinic with being a pulmonologist, not too much investment. Even in intervention related instruments are not very expensive. Cons, of course, you're first in line for a lot of exposure to COVID, multi-drug resistant tuberculosis, and many times physicians themselves treat pulmonary medicine. So nothing special that you're doing. Coming to my specialty, dermatology, before I go to the internists and hand over the session to them. So dermatology, I enjoy good quality of life, as I would want to call it. And you can earn reasonably fine as long as you're being good at what you do. There are no emergencies in my field. The only emergency that sometimes I see is the patient is free on that particular day. That's why he wants to see you on that day. Otherwise, there is no, major emergency. Of course, you have acute urticaria, angioedema, and stuff like that. Now, dermatology is not everyone's cup of tea. It is a visual field. It requires a lot of skill. You should have the liking to look at a particular part of the skin, observe it, and try to make a diagnosis on it. So I do remember having sessions with Sandeep sir in one of the hospitals in Bangalore, where we used to actually sit down and try to discuss the possibilities of differential diagnosis based on the medical condition and based on the rash the patient has. So definitely it's a medical field where you'd want to discuss, you'd want to think and try to understand what the diagnosis could be. It's not just, oh, everything is not tinea pruritus and psoriasis, so that is there. And it has a variety of opportunities, right from aesthetics, trichology, hair transplant, dermatosurgery. And for me, I would say it is a great mix of consultation and procedure-based practice. So you can do your set of procedures, you can do your consultations and be happy with having a mix of both. Cons: dealing with chronic diseases. Sometimes you come to a point where patients are just not happy with you. Patients can accept that diabetes and hypertension is something that is long-term, but it's not easy for them to accept that psoriasis is long-term. So and we face stiff competition from quacks and other specialties who want to practice as cosmetologists or, take up the beauty branches. And sometimes people look at dermatologists as just beauticians, and they want to be, they're often ridiculed and say, okay, you're not doing something really, really important. You really don't need to even be a part of the hospital, just so you can practice in some kind of a clinic. So that's another viewpoint by some. And there are new risks of artificial intelligence. Since it's a visual branch, artificial intelligence has already started. You have Google Lens predicting the kind of diseases a particular rash can look like. So internal medicine. So I would now ask Sandeep sir to throw some light on internal medicine, after which we'll be having views of Dr. Chanakya, and we will continue with this session. So Sandeep sir, I'll be moving the slides for you. Please share your experiences and your viewpoints about taking internal medicine, and a little bit on pediatrics if you can add up.
Yeah. The next slide, please, Dr. Govind. Thank you. Selecting the medical specialty. I mean, the important point is to know what is good for you. There are many factors that come into play when you want to pick up a specialty. But in my opinion, the foremost is your personality. Because that's gonna kind of be there with you for the rest of your life. So pick a specialty that matches your personality. Now, think about your personality when during your medical school. If you're the crazy, unpredictable person but with a significant attention span, then you should be in psychiatry. But if your span is just flops in a moment, but you're crazy, again, unpredictable, then emergency medicine is for you. So things like that, it depends on the personality of how you are, what you are, that should define the medical specialty that this should be there for you. Next slide, please, Dr. Govind. Yeah, now there are a few questions that I just put up to ask yourself as you're deciding a medical career specialty. Now, the first point would be, do I like diagnostics or therapeutics or kind of both? Now, let's say if you do not have the manual dexterity, then procedural specialty like general surgery, neurosurgery would be very difficult for you. It could be plastic surgery, orthopedics, and stuff like that. Now, I was just looking at the questions posted by the students here. Now, one student had a question trying to decide between orthopedics and dermatology. Now, you have to be clear, whoever the student is, you have to take a step back, because two different specialties. One is a pure surgical, one is both surgical as well as a diagnostic. You'll have to get your, again, the priorities right, because it's two different specialty, two different lifestyles, do different earnings, the way the life is going to be. So my sincere opinion to that, suggestion to that student would be, take a step back, think back, look at your priorities, and then kind of again start the process of ruling out different specialties. I think you're stuck somewhere. Again, one more student asked about emergency medicine, an amazing specialty that's coming up in India. By the time you finished another 3 years of your MD emergency medicine, you would be snatched away by many of the corporate hospitals who are trying to set up the emergency medicine departments in there. It's not anymore just a casualty with some duty doctors or of Ayurveda, homeopathy, or MBBS. It's going to be a pure emergency medicine team. So emergency medicine is going to be the next upcoming branch. If you're crazy, if you're unpredictable, you're good for taking decisions in a moment, think about emergency medicine. Again, coming to pure diagnostic specialty, answering one of another students about microbiology. As a person who's interested in infectious diseases, I'm falling in love with clinical microbiology these days now. Another beautiful specialty. Now their importance is being recognized. They're just not a person who is within the four walls of a lab. We are bringing the microbiologist onto our rounds, next to the patient's the bed, looking for a diagnosis, working with them. So my clinical microbiologist, another amazing specialty when you want to do your pure diagnostic specialties. Then there are a few mixed procedural and diagnostic, where you've got medicine and its subspecializations, like whether it is pulmonology, cardiology, neurology, radiology, where you have interventions to do. Even though there is a section of dermatosurgery that they do interventions, not just a pure diagnostic. So they do a procedural specialty as well. But if you won't be happy unless you get to do big surgical procedures, then you have to go into a surgical field. If you feel that only if I crack a bone, only if I put on nuts and bolts, only if I remove the entire part of the colon and be happy with it, yes, then a surgical field is good for you. Do not go into a mixed one, go into a pure surgical field. Now, the next question would be the predictability or the unpredictability. Are you a person with a personality who wants his or her life to be a predicted way? If you want your desk to be arranged in a very certain kind of a manner, like how it used to be, a little out of the things you would just be fizzled about, then go for an easy stuff. Go for the easy specialties. Emergency medicine is definitely not for you. Critical care medicine is definitely not for you. Anesthesia is not for you. Things like that. But if you love unpredictability, if you love facing challenges which can go haywire in a moment's time, then go for emergency medicine, trauma surgery, general surgery, pediatrics, and internal medicine.
So
now,
one point I just want to make to the viewers. Sorry to cut you short, but viewers, hang on. We will be winding up the panel discussion in about 15 minutes from now, after which we will be taking live questions. We have kept another 10 to 15 minutes for live questions. So all my participants will have an opportunity to ask your questions to the panelists, and we will be here to answer them. So do hang on. Yes, please go on, sir.
Then again, if you have any prejudicial dislikes of certain kinds of people or age, again, as Dr. Govind was mentioning, just because you like kids, it's not a reason to go into pediatrics. I love my daughter, but the specialty of pediatrics still haunts me, because I had a beautiful pediatric internship in my college, worked under an amazing professor. The only reason that I never wanted to go into pediatrics is the only symptoms that you get in a neonate is cry. I had a scary first year with my daughter, first 6 months with my daughter. She just cried and absolutely didn't know what to do. I couldn't do my differential diagnosis why she's crying. So, and the pediatrics, the another point that went against for me into pediatrics is their life is so delicate. My adult patients, I can start a medicine, start a treatment in the morning, I can come back in the evening and make sure, even if they're not doing okay, still have time till evening to see 12 hours, to see how they're doing, see if my treatment's working. But pediatrics, no. Internship again, I'd gone out with lunch with my postgraduates, came back, one of our patient was just coded. So was not supposed to. So the pediatrics, it's very unpredictable. So make sure you're taking the right decision. The next question would be if the limits, the well-defined limits, about again, do you want to know everything? Because emergency medicine, you should be a subspecialist in every specialty. Even you should know how to deliver a woman if a woman comes in labor. You should be ready to deliver a pregnant woman in emergency medicine. You should be ready to put a temporary pacemaker if a patient comes in bradycardia or a heart block, complete heart block. So in emergency medicine and critical care, your knowledge has no limits. But then there are more focused specialties like opthal, ENT, dermatology, and other departments where your knowledge will be more focused on your specialty, so you don't have to worry. I'm sure Dr. Govind doesn't have to worry whether to know the steps of labor because he can be focused on his dermatology. So there are a few factors that you'll have to decide whether you're okay with having a wide base of knowledge or just a focused knowledge. Next, team environment, amazing. Are you a team player? Were you part of the team management that conducted your utsavs in your medical college? Are you fine being in that team, working with people? Are you a sports person who love working in a team? So again, that makes an important point because as internal medicine, I have to work in a team. It's just not a one person's job. I have to get my subspecialties. I have to get my colleagues on board. I have to have my team on board to make sure my patient has a good outcome. So emergency medicines, there are so many orthopedics, surgical fields need to have a good team around to work to get a good patient outcome. So team environment, ask yourself, verbal communications. Am I an introvert? If I'm an introvert, I feel shy to speak, then definitely should choose anesthesia and radiology. Just get your patient to knock off with nitrous oxide, and then you can have your good time. Radiology, behind the screens, you don't have to worry about your patients. So again, verbal communications, are you an introvert, extrovert? Are you a shy person? Ask yourself. Now, many students have asked me, being in internal medicine, do I have to do a subspecialty or others, multiple specialties? I love being an internal medicine specialist. Any day, I would do it all over again, just be an internal medicine, love the job. You need to understand one thing with medicine and allied subjects is they're not super specialties for medicine. They're all subspecialty. You, as an internal medicine, is the specialty. Everyone should work with you. Now, and again, it depends. Now, working in the Bangalore Medical College, BMC&RI has a tagline for it, being as a traffic controller in Bangalore. Any neurology cases that comes to its doorstep, take straight, go right to Nimans. Any cardiology, take straight, go to left to Jaideva. Things like that. Urology, nephrology, go to another institute. But as my batch, we decided that we're going to change that. And post that, falling to work in a hospital with a good internal medicine professor taught me that you don't have to be a traffic controller. Now, my 1 year of work experience at Vikram Hospital in Bangalore taught me we used to admit all cases, every case, endocrine, rheumatology cases. We used to ask the opinion of the subspecialist, mainly for one, to learn, self-learning, second, and for legal purposes, so that the patient should not sue you later asking why I was not seen by a rheumatologist or an endocrinologist or a neurologist. So you get to learn, and the next time the same patient, another patient with the same condition walks in, you're well prepared to manage by yourself. So you do not have to be a subspecialist because you did internal medicine. And one more example I would give is one of the colleagues who then went on to do a subspecialist in neurology, walked into my outpatient department and asked, into my clinic and asked to refer cases for him. He's like, okay. He's like, now I'm a neurologist. Please, can you refer any cases, any neurology cases? So sorry to say, the subspecialty specialists of walking door to door of every internal medicine specialist asking for cases. Things have gone that way. And I'm so proud to come on screen to say that Dr. Govind and myself, we have treated so many of the complex cases. We remember treating a post-COVID dermatomyositis. Then we've treated so many cases together without requiring another subspecialties, because we tend to learn from, we tend to get updated on our subjects.
Just to break in to what you just said, we even treated a case of bullous pemphigoid, 86 years.
Yes.
Old with several complications, and
Yes.
me managing the skin part and you were managing the complications part. So that's another point I want to say. You can even decide whether you like a branch that admits patients or you don't like to admit patients. You might just want to be a branch that sees patients in the OPD and really don't like going ward to ward, rounds on rounds, to see patients. So that should be another thing that you need to consider while taking a branch.
Yeah.
Yes, please go.
And there was this one patient, an alcoholic, who had come to my outpatient with a skin rash, and then I had sought Dr. Govind's help, and he graciously called me back and said, "So you picked up an early onset pellagra, a case that you remember that it would be difficult to pick up, but you picked up a case of a pellagra in your referral notes that you thought it was pellagra. So you can update yourself. You can improve on being an internal medicine specialist by yourself. You don't have to do a subspecialty thing. But on the surgical side, I'm sorry to say that you have to do your specialties in surgical, because now, as just a general surgeon, no one is, they're going out of flow. They're just doing hernias, doing dressings and burns cases. Even appendix is being snatched away by the gastrosurgeons. So surgery, you have to settle in with a specialty in mind, but medicine, you can still be the king in your region with just being a physician. So don't worry of the subspecialties or multiple specialties. And the last one that I want you to remember, the last question is quite important, is can you tolerate the disagreeable aspects of the specialty? One of the specialty good on paper in the books is neurology. It's an amazing subject, but end of the day, when you have your patients on chronic disabilitating conditions, stroke patients, which is not going to improve, yeah, you have to accept the fact that you're going to have to go to your bed with that in mind. If you're okay with it, neurology is beautiful, and other some specialties which deals with chronic undifferentiated conditions, geriatrics, you'll have to. Otherwise, don't worry, you can pick up other easygoing, fun-loving specialties with ample of time. Yeah. There was one more thing. Yeah. Next slide, please. So Dr.
We'll be starting with DNB after your discussion. So
yeah. So done. Dr. Govind asked me to look for cons for a medical specialist. I said, no, I'm not doing any cons. There's no cons in internal medicine. There's always pros and challenges. We don't have any cons. So what are the challenges of being a medical specialist?
That's a very narcissist comment, sir. I will not agree.
Yeah. So you won't make as much as money, but money is not the end. I know right now, we were all in your stage of life when career and money was the main thing, because you're just living on your pocket money by your family. You look at all the luxuries in life, but as 10 years down the line, 6 years down the line, right now, my priority is family, and money is somewhere down 3 or 3rd or 4th.
So money, since you brought it up, I just want to make an important point since we're discussing this. When I took up dermatology, I actually went to one of the top dermatologists in Bangalore, and I actually asked him this question, how much money can I make as a dermatologist? So the answer he gave me is still something relevant to each and every one of us. I feel as a doctor in any specialty, there is a ceiling to the amount of money that you can make. And if it is money that matters to you, you have to go beyond being a doctor. You can do it ethically. You can open a lab. You can open other
pharmacy.
A pharmacy. You can have other avenues that feed you in various ways. But there is you may never be able to earn as much as maybe a businessman who's dealing with a lot of manufacturing, a lot of businesses and stuff like that. So money has a ceiling. So I think, as sir pointed out, that should not be one of the factors that really makes you decide what you want to do.
Because you're going to earn money.
Yes.
Whichever specialty you're in, you're going to earn money. But you have to decide on what kind of lifestyle that you want to be in that. If you find I come from a middle class family, and I love that. I want to be a middle class family. Good. Stay in that. The middle class families are the best, if you ask me. So stay in that. So that's the best avenue to be in. So money you're going to make in any specialty, please don't make it as a factor. The rest of the points you can always read up because we're getting short of time. So we want to move on to DNB. The last one I want to specify with personal listening to my partner yell. So that is one thing. You'll have to be very careful of who you choose your partner to be. Again, coming back to the first point, if you sense as a medical specialist, you're not going to make as much as money, so you marry a surgical specialist. Life will be balanced. So, yeah.
Oh, then I made a wise choice, then I should say.
Yeah, we all made. I made a really good choice. When I was doing these slides, when my wife is an obstetrician and gynecologist. She is doing a specialty here in UK. So she was looking at these slides, and she said, I didn't use any of these points to select my obstetrics. Then I said, yeah, I made you choose obstetrics. So it's always good to have someone on the other field of choice. So it balances your life. So I can stay at home, take care of my daughter, even at odd times when my wife has to go for a late night, OTs, emergencies. As a medical specialty, I can stay back, take care of the family, so I don't have to go with her, or there's no absence of parents for a kid at home, because I've seen and I've had my friends who both the parents were in surgical or in very high requirement, and the kids never had a good life. So I've sent some links here to discover yourself. This is all my UK students use them to give them a choice, to give them a selection process. Please do not regard that whatever answers you get at the end of the quiz, that is your specialty. No, it just gives you options, or you just have to think, okay, this is what my personality was, this is what my choices are. So it helps you refine your choices much more. And the book that I've shown, my UK students do swear on that book. They say that they've helped them a lot in choosing a specialty. So yeah, and the personalities that I've put in over is what makes an internal medicine a good one. Those are the personalities of what we are.
Nice,
thank you,
nice.
Doctor.
I guess with that, those lovely words and those, this slide is not needed. So with those lovely words, I think you have attracted a lot of people to take up internal medicine and just inspired them. Okay, we want to be like Dr. Sandeep, 3 years down the line. That was very nice of you to put those points, sir. And let us bring in my friend, Dr. Chanakya, who is closely associated with my field. I did my dissertation in SLE. So, I have always been associated with rheumatologists, and I was very happy to know that Dr. Chanakya did rheumatology. So, and before doing rheumatology, he did a DNB in internal medicine, and a lot of things are changing this year. DNB counseling will be a part of the MCC counseling, my dear friends. So before we go to branch versus specialty, before we go to other factors, let us invite Dr. Chanakya to throw light on DNB counseling or DNB courses more so.
Yeah, hi. Thanks, Govind. Exactly, I remember in 2010 and 11, when in 2010 to be precise, I was preparing for entry into specialty courses. So just to begin with, so I'll give you my experience or how I choose to the branch of internal medicine. So all through my medical school, my college in BMC&RI, so I was fascinated by the glamour, which Satish sir told, that I wanted to be a surgeon. So it was all that I wanted. I want to walk out of OT having cured something, resected something, or having set right some abnormal stuff and all. And I enjoyed reading surgery too. So that was what I wanted to do for my life. Then I entered my internship. I started putting my heart and soul into every posting of mine. I wanted to learn medicine in all fields of medicine, the way they are, what they had to offer. And I have to tell you, frankly, I started loving every branch that I was in. Like, I started loving pediatrics, I started loving surgery, orthopedic, obstetric and gynecology, every branch, ENT. So at the end of my internship, I was a bit confused. I mean, confused means I loved everything. I decided that I could do anything that was thrown at me, but then I had to make a choice. But surgery was my love. Surgery, like through my MBBS days. But then I chose internal medicine because that was the posting where I like how Dr. Sandeep described the qualities. I was patient. I had a lot of patience in interacting with patients. I loved the way my professors diagnosed, and they read the ECGs. They made complex diagnosis. They could handle the complications of any surgery or any case. And most importantly, an internal medicine person knows everything about all diseases, about what has to be done towards it. So that was my perspective upon choosing internal medicine as my branch. So now coming to DNB. So as like many other aspirants, PG aspirants of my batch, and that, so I was preparing for All India Karnataka State Entrance. At the same time, DNB exam was scheduled. So I did not have a particular preference for like DNB or MDMS, like, but obviously I wanted to take MD if I could get it. So that was the way I had written my exam. So my first exam was DNB exam, which I remember giving at the end of my preparation. So I had got a very good rank in DNB, and I was confident, pretty confident that I would get a good rank in the All India as well to get an MD internal medicine seat. But unfortunately, I was not able to get an MD internal medicine seat, but with my good rank. So all my friends started suggesting, you've got a very good rank in DNB, why don't you take up radiology? I had never actually thought about radiology, just like how it happens with so many other people. You are a topper, you take radiology. So that's not the case. You should not do that. So I started. So the main thing that you should concentrate while selecting DNB seat is to pick a place where you do this. So this is a little different from the MD courses that you do. You usually, even if I would have done MD wherever I have got it, I would have got it. But for DNB, I did my research. I spent at least 1 to 2 months of my time in picking a college. So first, let's look at some facts legally. So when you open the DNB site website and see, if you legally means it is pertaining to High Court, Supreme Court, and all the gazette notifications of government of India. So DNB is equivalent to MD and MS. I don't know why this differentiation came. So the reason I know DNB course was started was to serve the, expanding population, our expanding need of doctors. So we needed another, so many corporate hospitals were there which needed to train people so that they can go and serve. Yes, so legally, if you talk, DNB is equivalent to MD, but in reality, this is not widely accepted. I can say that from my personal experience, due to various reasons. I mean, people do not want competition. People think the training is subpar, which is true in some cases, in certain hospitals. But with time and with improvement in training, more and more people going and practicing, people who are interested in teaching, going and practicing in corporate hospitals and training their DNBs well, this acceptance is changing. And now if you look at people passing out DNB, they're very good in all aspects of their field. So what I would suggest is, to do a decent background research of the available options. So what I had done was, so it was internal medicine. So I made a list of all the colleges and hospitals that were offering DNB. What things you have to consider while making this decision is, what is your area of future practice? Do I want to be an academician in a government college and teach undergraduate students, postgraduate students? Do I want to work in a corporate hospital, which is there in a large tier 1 city or tier 2 city? Do I want to have my own private practice or a clinic in a city? Do I want to work in a tier 2 city or at the taluka level or at a district level, where I have my own hospital? Or so all these things have to be your primary consideration when you want to choose DNB. So if you plan to work in a government medical college and ascend academically, like you want to be an assistant professor, associate, additional, and professor, as I said, DNB is legally equivalent to MD and MS, but there are some you will face. This is reality. This is hard reality. You will face some tough challenges and some discrimination while ascending your path, but you can progress. There is absolutely, I have a few references attached which will tell you you can progress in them as well. But what doesn't matter, so if you want to work in a corporate hospital, yes, DNB doesn't matter. If you want to work in, have your private practice, DNB doesn't matter. If you want to have your nursing home in a different city, anywhere else, apart from progressing in a academic medical center, that's a government medical college, becoming progressing from assistant professor to professor, rest all other scenarios, taking a DNB seat wouldn't matter. Yes, so that's one. I'll cover about what are the different things that you need to progress as an academician in the government institute in my next slide. So next thing is about exit exam of DNB. So this was a particular concern to a lot of my colleagues as well as me. So my experience was, I took up DNB saying, okay, exit exam is tough. Okay, that's a challenge. And if I don't, if I'm not getting through the challenge, maybe I'm not trained well enough, let me take it up. So that was my view about it. Everyone can have a different view about it. Okay, it's too tough, I can't deal with it. Yes, it is tough, but with time and with good training everywhere, I think the exam is still tough, but the passing rates have improved. The why is it tough? Because it's not in your home college where you do. So I did my DNB internal medicine at Bangalore, St.Johns Medical College. My exam was in Kerala. It was in a government medical college, Thrissur. So I did not know anyone in that place. I did not know the language. The professors, the examiners had never seen me. So I had to literally prove to them that I was worth to be passed on that day. And you can have a bad day anytime. So you may be very good throughout your 3 years, but you can have a single bad day. On that day, you may fumble, you may do some blunder. That happens with every human being. So you have to consider this, that exit exam of DNB is tough. So on my day, out of about 7 to 8 candidates, only 2 of us passed, and it's tough. I mean, you don't want to fail in exams, but yes, with time, things are changing. Yes, so, and next, if you have plans of specializing, that is sub-specializing from internal medicine, you want to do cardiology, nephrology, neurology, gastro, rheumatology, any other branches, doing DNB doesn't affect your course at all. So you will do DNB, then you will take up your DM or DNB subspecialty, and then get along with your career. So these are the things that you need to consider. So you need to choose wisely. So about your progression while you are in academic medical center. So the requirements are like this. So if you work in a hospital or a medical college, yeah, good. Thanks, Govind. So I don't know. These are very small. These are there on the DNB website actually. If you go on this, so if you do your DNB from a medical college which is MCI recognized, which has been running other MCI courses, and or if you do your DNB from a hospital which is got at least 500 beds, which most of the bigger hospitals have got today, and which have got other multiple subspecialties, and the DNB teachers who are there, usually 3 DNB teachers are needed to start a DNB course. So two out of them have got recognized degrees to teach DNB students. So these are some of the requirements. If you do your DNB in such hospitals, then you are at par with an MD student who passes out with you in the same year. If suppose your hospital doesn't have these requirements, means you work in a hospital which is which has got less than 500 students, 500 beds, and other requirements which are not met as in the point B there, then you, after you pass out your DNB, you have to do additional 1 year of senior residency in any medical college which is MCI recognized. 1 year of senior residency to be eligible to for the post of assistant professor in any of the medical colleges that you want to enter. So this is 1 year that you will have to do if you do not meet requirements. So I'll just give you a practical example here. So I was studying with a batch of friends, group of friends, like 5 of us were there. So all of us, as I said, all of us has written DNB and we had got good and decent ranks, and we were not getting our choice of our branch in MD. So we all choose DNB path. So I took up DNB medicine. So I was able to get it in St.Johns Medical College Hospital. So I had an excellent training, I have to say. My other friends took up DNB medicine in a private hospital in Kerala. At the end of 3 years, what I realized was, so his hospital was, yes, it was more than 500 bed hospital and all that stuff. See, every hospital has got some strengths, some weaknesses everywhere. The training in every institute is like that. Like suppose I would say that the place where I trained, I was not very confident with critical care because the clinical load was too much, and I was catering to a lot of outpatients, a lot of ward patients, inpatients. I had got, I think, just 1 month of critical care, which was not sufficient, I thought. Whereas my friend who worked in a corporate hospital was like posted for a year in critical care, and he was like expert in intubations and so many other procedures managing critical care patients very well. But I was very good at presenting cases on rounds, but he was not so good at that, which is actually required to pass the exam. So these are certain things, but at the end of 3 years and probably a year of you're working in a hospital and all of us are same. We love internal medicine. We want to progress in that. There are so many ways you can progress in that. Yeah, so these should be your considerations before taking a DNB, but a very good background research is necessary. What I used to do is I picked up a college. I used to find out some seniors in that college or some people who are actually doing the course there. I used to talk to them about the patient load, work, passing rate, about learning all aspects of medicine, what are the future prospects. And I used to tick off some colleges, say no to some colleges or hospitals, and then decide.
So I actually, as a team of medical mentors, so the Excellence Career Shapers group actually does a lot of this. We have services like Know Your College Before You Choose, and a lot of these things that we'll be discussing. So anything else that you want to add,
yeah,
Chanakya, about?
That's the main message that I wanted to give. So do a proper background research before you choose.
Thank you. So just before we go to question and answers, one single vote from all 3 panelists. Okay. Specialty versus college. Now, this is a very big compromise many people have to make, so many people ask, should I take the specialty of my choice in a bad college, or specialty which I don't want to take in a very good college? So one of the analogy given to me by my senior was, do you want a very beautiful spouse who's not a very nice person, or do you want a very nice spouse who may not be a very beautiful person? So what is your take, Satish sir? What should we choose? A specialty of choice or a very good college?
No, it is really important. See, for example, a surgical field, unless you mentor under a good surgeon, I don't think you can be a very good surgeon immediately. See, the only choice there is, okay, you get your degree and start working with somebody who has a reputation. Then build up your career. Because sometimes, as you said, you may not get all the qualities in your bride. So somewhere you have to compromise.
So definitely. So
Take the degree,
it's better to compromise on the college than on the specialty. What are your views, Sandeep sir?
Yeah, I agree with you. I agree with you. See, you have to take the degree. Then you develop. See, it's not at all an impossible task. Only
Yes,
thing
sir.
you have to choose a good mentor and then start learning again. Okay?
So it's just a matter of 3 years. Okay.
Sometimes, and for your own good, probably.
Yes. Sandeep sir?
I would say pick the smart spouse, because Dr. Govind is always there to make them beautiful. So, but on a serious note, pick the specialty, and college-wise, I mean, so I can't speak for surgical subject, but for medicine subjects, and coming from BMC&RI, this is not MBBS. Do not think you'll be in a class, a teacher standing with slides and spoon feeding you information. No, the professors are going to come, they're going to do their duties, they're going to do their OPDs rounds, and they're going to go back. They're going to harass you on your journal club presentations. You would have seen that as an intern. You would have been there when your postgraduates presented. They would harass you. They would show you what to be a professor is. But then post-graduation, specifically with medicine, is self-learning. So pick your specialty. And with colleges, my sincere opinion, do your specialty in a college where the quantity is more, as in a government medical college, where you have a government or a medical college associated with, linked to a government hospital, where the quantity is more.
Obviously,
because here in the post-graduation, all you have to learn the skills. You have to make mistakes to learn it from there. Because once you finish your 3 years, you're a consultant. You can't make any mistakes more. You are a consultant. People will consult you. You can't say, I'm still learning. You should have learned by the end of 3 years. And then once you come out of your post-graduation, then you can pick up a finer institute to have those fine skills, do a fellowship, a master's, or a diploma, and find your whatever skills that you want to be best in with your specialty. But do it in a medical college for your post-graduation, where it's linked to a government hospital, and it teaches you the enormous number of the patient load, exposure to different types of patients that can come across. So a large institute or a college associated with a government hospital, and the specialty.
Yeah, so the question was basically, obviously, if you have a good rank, you can get the college of your choice and the branch. So the question was more about a compromise, but yes, we got your message. So that's it. Chanakya, one word: specialty is more important or college is more important?
I'd go for specialty.
Okay, so I think that's unanimous. I would say that choose a specialty that you really like. And of course, if you get it in a great college, nothing like it. Nothing like having a beautiful wife who's a very good person. But if you have to choose one, then you have to choose the nice person, you know. So we have, I'd like to discuss a lot of these slides, but I think we are running short of time. So I would want to start taking questions. I didn't want to interrupt my panelists because they were giving so much of information. So let us answer some questions. Vikram sir, I would like you to come in and help us, have our students, if you can give them the opportunity to speak. So students, if you want to ask a question, please raise your hands. There's a raise hand option, and Mr. Vikram sir will allow you to speak. You can ask a question to any of the panelists or me present here, and we will try to help you make, if you'll try to answer your question to the best of our understanding. So
Right. So I'll allow Dr. Kavya. Dr. Kavya, you need to unmute yourself.
So good evening, sir.
Yeah, hi. Good.
Sir, I want to become an ophthalmologist, but I just hate doing that surgery part. Can I become an ophthalmologist without doing that surgery part, sir?
Your question is to whom?
I think
All the panelists.
I think Satish sir might want to take up that question. It is like someone
Kavya.
just wants to look into the nose,
My
not
take
operate on the nose.
my take on this is, yes, you can become a ophthalmic physician, no doubt. But once you get into the specialty, I think you will love surgery and become a surgeon also. But yes, you can become a physician. You can start prescribing contact lenses, glasses. Then you can look into their pressures. Lot of opportunities are there. And I feel once you are working in the department for 3 years, definitely you will become a surgeon. And all the best for you.
Thank you, sir. Sir, another one question. Sir, at 50K rank, what clinical branches can we get in management?
I think that's a little out of the scope for this particular webinar, and Mr. Vikram sir will be helping you with this. So please do contact the team of medical mentors.
Anything about the counseling process, you can get back to us later. This is only purely, this discussion is about the branches and all this, right?
Okay, sir. Thank you, sir.
Thank you. Dr. Likita J. Dr. Likita J. Yeah.
Hello.
Hello. Yes, doctor.
Hello. Good evening, sir. Sir, my question is to all the panelists. So you guys did a wonderful job. You guys gave me a very good insight. My question to you all is, in case you were stuck when you guys had to choose. Sir, am I audible, sir?
Yes, go on.
Yeah, sir. When you guys had to choose between, I would say, let's say dermatology and general medicine, if you are interested in both, and you ended up taking general medicine because you're more passionate about it, there might have been times when you might have regretted it, no, sir, like in case of too many duties or stuff like that. So how do you guys deal with it, sir? Do you feel like if I had taken dermatology, maybe I would have been in a much better place, or does it just fade with time, sir? How does it work, sir?
Okay, I'd try to answer this question for you.
Sandeep, you want to answer?
I want to answer. It's nice.
Okay,
Now,
fine.
I want to put in my word here is just that there was an interesting, amazing experience during my post-graduation at BMC&RI, and as well, during my second year, we have to do rotations with other allied subjects like dermatology, psychiatry, and stuff. So I still remember in my dermatology rotation, I was sitting alongside a senior dermatologist who just finished his post-graduation. So just sitting along with him, tagging along with him to see how he's doing. And he posed a question to me and said, Dr. Sandeep, your life should be more interesting with all the ECGs and numbers and labs, and all I do is prescribe creams, look at a rash and prescribe creams and tablets and citizens for itching. I don't know why I got into this thing. Then why did you get into dermatology? It's like, I was sitting in the counseling, I had got a rank, it was all in the list. Someone said, do dermatology, good money, 9-to-5 job, nothing to worry about emergency. So I said, okay, let's do dermatology and things. And 3 years, he just finished his post-graduation and is already regretting it. So I keep saying to all the students who called up for mentoring, who approach me personally or on social media platforms for mentoring, and they say, am I going to regret? Is if you pick the choice of specialty through your own opinion, then you're not going to regret. If you pick your specialty because your mom said so, your father said so, your spouse or your future fiance said so, or Dr. Govind or Dr. Sandeep said so, then you're going to regret. So please pick the specialty of what you want. I mean, take all those 5 years of medical school, your internship, speak to all the consultants out there, do observerships if you have time, visit the nearby hospitals, sit with different consultants and see what is a 9-to-5 or a day of a internal medicine specialist, what's a day for a surgeon, and then decide for yourself. Do not decide just because someone said so. Then you're not going to regret.
That's so well put, Sandeep sir. It's just like, again, I come back to the fact that it's like marriage. So if you really love someone, and even if you're married to that person, and you know, you may, the marriage may or may not end up well, but if you just ended up in that marriage because someone else asked you to end up in that marriage, then you may really not, you know, like that decision. And I am,
and you can always have an affair, divorce, have another marriage. For specialty, once you're into it for life. You can't say now, after 10 years, after 9 years of getting into medicine, I can't say, no, I like dermatology or I like surgery, let me do surgery now.
No, sir.
My daughter's not going to let me do that.
I like internal medicine, sir. So I think I should become your associate sometime. Okay, that was a good take. Thank you so much. The next question, please.
Dr. Diksha Garg. Yeah.
Yes, sir. Good evening, sir.
Hi, good evening.
So I like both dermatology and pediatrics. So I just wanted to know like how to choose between the two.
Okay, so I'm making an open offer here to any MBBS student in Bangalore. If you really want to come down to my clinic, spend one day with me in my clinic, I'm open to that offer. That I think that is a sensible thing that I can offer as a senior to you, because I think you guys should take an informed decision of what you are getting into. You know, life is not as glorious as it looks from outside for any branch for that matter. So you are all welcome to come one by one, spend time with me or with any dermatologist or any specialist of your choice. Speak to people. People will be more than happy to let you enter their clinics, let you enter their hospitals and have a look at how things are going on. I think we ourselves are very shy about, you know, not taking this step. So go and approach people, specialists of various choice, say you want to work with them for 2 days, 3 days, 1 week, whatever. And if that helps you make a better choice, it is great. So it is very tough for me to say pediatrics versus dermatology. You'll have to look at a lot of things because pediatrics is totally with children. You have an upcoming branch of which is pediatric dermatology, where we see dermatological issues of only children. You have fellowships in pediatric dermatology, but if you, broadly, they are two vastly different specialties. Although both are medical, dermatology can be partly procedural, but they are vastly different branches. So I think you need to think more about each branch individually.
Sir, and how is like pediatrics as a branch? Like I'm always more inclined towards pediatrics.
You like so pediatrics is veterinary science. How much ever someone tells you this, it is less, because you need to experience it. You need to go to a pediatrician's clinic and you'll realize that the child says nothing and the child only cries when you're in front, you know, the child is in front of you, and it is, you have to finish your examination like that. You know, are you really good at picking up signs in children? You know, you have to be quick, you have to be specific, ask the specific questions, and be ready to answer the big set of questions the parents are going to ask you. So it's not about managing the child, it is also about managing the parents. That is the bigger job in pediatrics. So
if I can just barge in here.
Yes.
I think if there's one specialty that has an emotional attachment bond in this, is pediatrics, because see, in adult medicine, if I have a geriatric death, the family is going to cry over, mourn over, they're going to get over the fact, but you have a death of a child in the family, it never goes away. The emotional attachment is too high, and if you're a person who's strong in heart, who's not going to break down at the death of your first patient, then yeah, pediatrics, take it. But if you feel you're a very sensitive individual, you just can't take those factors, then it's going to be a difficult road ahead in pediatrics, because you can pick. You don't have to be a neonatologist where only just babies and crying. You can go into a little adolescent medicine where you see more of the other stuff, or you can be a pediatric endocrinologist and just be with 9 to 5 job, no emergencies. So yeah, but the sensitivity of a personality plays a major factor in choosing pediatrics.
Very true. Very
so
true.
like if I'm not into like too much of emergency handling, is there a scope in pediatrics?
Yeah. As I mentioned, you can just go into adolescence medicine, Endocrinology, have just 9 to 5. Make sure your kids are all vaccinated, your patients are vaccinated, run a vaccination clinic, and referrals. You can do a subspecialty in pediatric neurology, endocrinology, cardiology, and just be done with that. So you don't have to deal with emergency.
No, I have a suggestion. She can become a pediatric dermatologist.
Thank you, sir.
Okay.
Okay.
Dr. Megha Kiran GS. Dr. Megha Kiran GS. Dr. Megha Kiran.
Hello.
Yes, yes.
Yeah.
Am I audible, sir?
Yeah, clear.
Sir, I wanted to ask you about radiotherapy once.
Radiotherapy.
About?
Radiotherapy.
Radiotherapy.
Yeah.
Dr. Satish, sir, you would like to take this question?
Yeah. See, radiotherapy is a branch, and the only drawback there is you have to be in a college or a big center where they have radiotherapy units. Otherwise, it's a good specialty because you're treating cancer patients, and this chemotherapy is a big topic, and it's good, but the disadvantage is you're likely to see a lot of patients who are
Terminally ill.
going to terminally ill and other things. You should be a very strong person to hold on to that. And again, you need a bigger center to settle down. So think twice. If you have other choices, please get into the other specialties. Or if you are really interested to treat cancer, do research. This is a very good branch.
Thank you, sir.
I'll take Dr. Pradeep. Dr. Pradeep, you need to unmute yourself. Dr. Pradeep. Okay, I'll take Dr. Sandesh Joshi. Dr. Sandesh Joshi.
Hello, sir.
Yeah, hi.
Hello.
Sir, my question was, sir, in internal medicine, there is like so many subspecialties being propagated these days. Is there a complex of not being good enough in them since within 3 years after that, you'll be a consultant and not being good enough in one particular branch when you come out will affect your practice after that?
Absolutely not. See, once you've decided that you want to get into internal medicine, you have a choice of 3 years. Next 3 years into the post-graduation, you can always pick up. You'll be exposed to other different subspecialties, and you'll always know where your true love is, whether it's in internal medicine or is it one of the subspecialties that has amazed you.
Okay.
End of 3 years, if you feel that, okay, I'm not good in neurology, I'm not good in gastro, I'm not good in endo, I'm too scared to take up, I don't like either of those, you can still continue to be a physician. I continued to be a physician, even though my batch, many of them took different specialties, but they still call me. I can give you this example, a beautiful example. My rotation during my post-graduation in NIMANS for neurology, we were doing rounds. Another amazing professor, NIMANS has got amazing professors, another amazing professor, we're doing rounds with him. His post-graduation was presenting his case to the professor, and he said this patient's got present complaint is fever. And this amazing professor, who's like too good in neurology, he was looking out for medicine PGs, postgraduates from BMC&RI, because this patient had fever. They're like, where are the postgraduates from BMC&RI? Like, we raised our hand. Can you treat this patient? He's got fever. I was so amazed. The professor of neurology in India are asking us to treat this patient for fever. Internal medicine specialists are required for every other specialties. They are so good in neurology. They want their patients to be treated by an internist. We call ourselves as an internist here, for fevers, for your diabetes, for your hypertensions, for your myalgias, for everything apart from neurology. Your cardiology will just do an intervention, but he wants the rest of the things to be taken care of by his internal medicine colleague. Now, my practice is that you have to keep updating yourself with the enormous amount of information that's out there, trying to make sure that you're always updated whenever a patient comes to you. You never get to pre-select your patient. Surgeons can pre-select. Surgeons can select, I'll operate on you and I'm not going to operate on you. But as an internal medicine specialist, you're sitting in your clinic or your emergency, any patient that walks in, you have to be ready to treat it. So you have to be really good at it. Now, I would refer a patient to a different subspecialty only for one, legal purposes, so that it's on documented that I've taken a help of a rheumatologist or an endocrinologist or dermatologist. No offense, Dr. Govind. I love referring cases to you. But then I learn from Dr. Govind and see how the patient was managed by him. And then the next time a patient walks in, I know now how to manage this case, how to manage a cardiologist case in heart failure. I don't need my cardiologist anymore. I only will require my cardiologist only if I need to do an angio. Require my pulmonologist only if I do want a bronch to be done by him. Otherwise, asthma I can manage. COPD I've learned to manage. The only reason I can manage all these cases is because of the amount of exposure I got during my post-graduation at BMC&RI. So your post-graduation, if you do it at a place where the exposure is quite high, then you can manage any patient that walks into. You will be confident of managing your cases, but make sure you have a good team like Dr. Govind and other colleagues around you who can come into your help at any need of the hour. So you can still practice internal medicine without worrying about whether you want to be a subspecialist or not.
Thank you, sir.
I'll take one more question. Dr. Ravi Kosik. Dr. Ravi Kosik. Yeah. Hello.
Hello. I want to ask the panelists a question. Good evening, sir. I want to ask the panelists a question. Is choosing MD pharmacology a good option, and what would be the future prospects?
As I mentioned, MD pharmacology is one of the upcoming specialty. You will be snatched by the pharmaceutical industries out there. You get into clinical trials. I tried to apply for a clinical trial. They said, no, we need MD pharmacology. So damn it, I'm an internal medicine, infectious diseases, and you can't get me into a clinical trial with COVID patients. And they said, no, we're doing with this drug and we want an MD pharmacologist. I'm like, damn, MD pharmacologist. So yes, MD pharmacology is an upcoming field. There are going to be diseases, conditions, non-communicable, communicable lifestyle conditions, which will require drugs, and MD pharmacologists will never be. Now, monoclonal antibodies are the next level of medicine that we're going to look at. You guys will be in the forefront for all the monoclonal antibodies. So
if you,
keep in touch if you do MD pharmacology.
I have a batchmate. That was a nice one. I have a batchmate who's done MD pharmacology. So Dr. Ravi, you can send us a mail and I can connect you to people. So we are here to provide you resources. We are here to help you. We cannot bring 20 panelists on a Zoom call and answer questions with all the specialties, but we can connect you to them if you want to make a choice. So please do reach out to the team of medical mentors. We are more than happy to share our email IDs with you and reply them with other resources, whatever we can, because 1.5 to 2 hours is very small time to do justice to everything. So I think we will take another last question, Vikram sir.
Yes, sir. Last question will build one. Yeah. Dr. Akshata Vellore. Dr. Akshata Vellore.
Hi. Actually, my question is to Dr. Sandeep sir as well as Dr. Satish sir. Actually, I'm a student of Dr. Sandeep sir in RRMC, and I remember I remember talking to him about emergency medicine. So I just wanted to know, because I'm still considering it, because I was initially studying for PLAB to go for emergency medicine in the UK. So my question is, sir, that like when it comes to emergency medicine, especially in India, if I have to study it right now, what would you think, like what would be a better way of the studying, which course would be better, DNB versus MD for emergency medicine? considering it's a very upcoming field in India?
It is an upcoming field, and I've got kind of personal experiences when few of the patients got referred to me by different hospitals, which were dealt by emergency physicians. Few of the colleges were not up to the mark because it's still upcoming. DNB happens hospitals, and Apollo is doing a great job trying to do fellowships and some courses with emergency medicine hospital. So emergency medicine, your college becomes quite important. The institute or the college where you're doing becomes quite important, and you have to go there because emergency medicine is again about the exposure number of cases that you're going to see. You just can't be in a hospital where they just see one snake bite in a month, one cardiac case in a year, and things like that. You need to be, as I mentioned, emergency medicine is more broad-based. You need to have exposures in all the fields of specialties, be confident in that. Only way to do that is the exposure that you're going to get during your post-graduation. So go to the college, personally spend time in a day, 9 to 5, and if possible, till 9 o'clock in the night, see what night cases do come out there, and then do your selection of the college. College becomes very important because in India, it's still improving, developing. So go to the college, 2-3 priorities of your college, whether you want to be within Karnataka, within a specific state, north, south, east, west, and make that trip to that college, spend time, see what type of cases that they're dealing with, and then do the decision.
Okay, sir. Thank you so much.
Don't be scared to work hard. That is what Dr. Sandeep is trying to say. Whether you're a postgraduate or whether if it's your early years of your life, me and Dr. Sandeep are 5-6 years to 8 years post MD, and we do try to enjoy a good family life. But there are times when Dr. Sandeep and me leave the hospital at 10 in the night, and Dr. Sandeep sometimes 11 in the night after having come in the morning at 9. So it doesn't end with post-graduation. It is a commitment. So hard work is a commitment that you're doing to yourself. So don't be scared of working hard. That is something I would like to tell everyone. And any closing remarks from Satish sir, Sandeep sir, and Dr. Chanakya, and we will try to close the...
See, only one thing I want to tell you, as I told earlier, see, you have interest in some specialty. Yes, if you are lucky and you have worked hard, definitely you'll get it. Even if you don't get it, have a plan B. For me, even a preclinical subject or a paraclinical subject is as good as a clinical subject with a lot of spare time, and your quality of life will be very good. And if you excel in that, definitely there is nothing to worry about, number one. And a lot of times, Govind and others were telling about marriage. It is something like love marriage and arranged marriage. See, ultimately you have to love your spouse, that's all. So whichever specialty you get into, please love that subject and reach the pinnacle, and all the best for all of you. Thank you, Govind.
Thank you so much, Satish sir, for your words of wisdom. It was wonderful to have someone of your stature and experience as a part of our panel.
No, it was my pleasure. Thank you.
Thank you. Dr. Chanakya, your closing remarks, please.
Yeah, so I agree with what Satish sir said. Have a plan B. You will love your branch once you are into it. That I am sure, whatever branch you take. So now, being in internal medicine for so many years, I actually think being a pathologist, being a microbiologist is so good and so challenging. So there is no branch that I do not like. It's just that it's your decision. Make an informed, it has to be your choice. That's it. And all the best to everyone. You'll excel in whichever branch you take up.
Thank you so much, Dr. Chanakya. He has joined on a weekend all the way from Mayo, Minnesota. Thank you so much for making it, Chanakya. It was a pleasure having you on the panel.
My pleasure too, Govind. Thank you.
Yeah. And Sandeep sir, our star internist, please give us your. It is a pleasure to refer cases. Forget having him on the panel. You know, it's a pleasure to refer cases to Sandeep sir in the hospital. He still sees each and every case with PICCKLE, JVP not recorded, or JVP not visible. You know, it is so beautiful to see someone who's so meticulous at his work. And I think that is what is going to drive you to excellence. Hard work, being meticulous at whatever you do, immaterial of which branch you do, is going to take you to pinnacles. So Sandeep sir, your remarks.
It's an honor to be working with you, Dr. Govind. It's been a pleasure. I would cite an important line of a poem is, there are miles to go before I sleep. So this is not it. And as Dr. Chanakya clearly mentioned, whichever specialty you go into, once you step into the doors of that specialty, you're going to love it. The only thing is you'll have to understand is you have to love it. You will, the moment you start questioning what is happening in your life, that's where things are going to collapse. The major example that I would give to anyone is Harsha Bogle. If you have to be good at in any subspecialty, in any field, you have to be like Harsha Bogle. You ask him anything about cricket. It's just a cricket. It's just a commentator. But of all the commentators, the knowledge that on cricket, and at any point of time in the years gone by, you ask him which bowler, which batsman, what ball was bowled, he will tell you exactly how the things happen. So you just have to be like it. Whichever specialty you take, try to be the best at it, and you love it till the last breath of your life. No matter how difficult it is, whether you're walking back out of the hospital 11 p.m., but you'll still go to your bed with a deep sense of gratitude that you've helped, that you've saved a person's life, that you've made a difference in someone's life. No money can buy that. Take it from me, us friends. No money can buy you happiness. No money can buy you a peace of mind. End of the day, there are so many unhappy rich doctors who are spending their money in psychiatric clinics, counseling, Sadhguru sessions, Sri Narayana out of living centers, but they're not happy. Yeah. So be happy and love the road that you've taken.
Fantastic. Thank you
Cheers
so much, Dr. Sandeep, again joining us all the way from UK on this afternoon of yours on Saturday. And thank you so much for being a part of this webinar. It was quite a pleasure to have you. And the lines that Dr. Sandeep wanted to say is, the woods are lovely, dark and deep, but I have promises to keep. Miles to go before I sleep. Miles to go before I sleep. By Robert Frost, stopping by the woods on a snowy evening. Okay, so those would be my closing remarks as well, because I've already said a lot. I hand over the session to Vikram sir for his words, please.
Thank you, Govind sir. So thank you all doctors for joining us today. And definitely this was very, very, very helpful and very much needed session. All the doctors, those who they were requesting this kind of session. So I hope you have a very good clarity. And even as sir said, if you need further guidance, you need further support for choosing a branch, definitely we have all, we have, our team will be very, very happy to help you. And we will be, with the help of Govind sir and our esteemed panelist, will be able to connect you with the right person who can guide you further, in selecting your branch or, in further guidance. So thank you all and see you soon.
We will see you soon in the upcoming webinars. Dear friends, thank you very much for joining us. So this is the team of medical mentors with our esteemed panelists signing off today on a Saturday night. Have a good night and have